Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, it's great to see you. It's great to have you here. We're super excited because we've got just some incredible conversations with some fantastic leaders that are painstakingly shaping the future and reshaping the future of healthcare. We happen to be really passionate about a few different things. We're passionate about leadership, access, innovation, adoption, and if it's your first time tuning in, let me just sort of take a quick step back just to kind of give you a little bit more on what we're trying to do here. So the focus is on bringing real stories of innovation within our space to life. And it's highlighting real people that are actually doing things. And not just the wins, also highlighting some of the learnings. And if you haven't had any opportunities to check out any of our historical interviews, just wherever you are now, whether you're watching this or listening to this, just please make sure you hit the subscribe button now so that any new interviews come directly to you. So our field is constantly evolving, it's constantly shifting, and it's crucial to have leaders that really envision a future and differently. They're embracing innovation and they're addressing these pressing challenges. And there's no shortage of challenges, which means that we've got lots and lots and lots of opportunities. So our next guest on the show is one of these leaders, and we are honored to introduce an outstanding leader in pediatric medicine, Dr. Sandy Chung. Dr. Chung isn't just a pediatrician, she's also a visionary who works tirelessly to improve children's healthcare across the board. As the immediate past president of the American Academy of Pediatrics, Dr. Chung worked alongside 67,000 healthcare professionals to advocate for the health and well-being of children everywhere. So her leadership helped carry the organization through some interesting times, always ensuring that the focus remained on childhood health and family well-being. So Dr. Chung also serves as the CEO of Trusted Doctors, where she leads a team ensuring top quality care for kiddos in Virginia, Maryland, and the District of Columbia. Her work doesn't just stop there. As if she's not busy enough, she also is deeply involved in improving mental health care for kids as the medical director of the Virginia Mental Health Access Program, and she's played a critical role in making sure mental health services are available through pediatric practices all across Virginia. And then also taking on yet another impactful role, Dr. Chung is the CEO of the Health Connect IPA. So in this position, she focuses on enhancing patient care, improving health outcomes for entire populations, and working to make healthcare more affordable. Lots and lots of things that she does. I probably didn't do it justice, Dr. Chung, but welcome to the show. It's great to see you. How are you?
Thanks so much for having me, and you did an amazing job. It's a lot of things, and it's been so much fun. Um, and I like to say I also have four kids, so I have an amazing opportunity to take care of kids in my very own home. So it's awesome.
Yeah. So I kind of want to talk about sort of your origin story. Our stories have a bit of overlap. So I'm the son of immigrant parents, as were you, and I grew up differently than many of my neighbors, as did you. I'm just sort of curious, how did these early life experiences really sort of shape or influence your decision to pursue a career in medicine?
Yeah, it's an amazing sort of journey that I never could have predicted. And I think for so many of us, that's true. And we are very much shaped by much of our childhoods. And I've talked to a lot of people where their choices in becoming whatever they've become was impacted by someone they met at some point in their lives when they were, it may have been when they were young adults. It might have been when they were 9 years old, which was my story. And so, to back up a little bit, my parents immigrated here from China, and my dad had a master's degree in computer science and journalism. My mom had a college degree in mathematics. But despite that, they actually could not get professional jobs when they came to this country, largely because their English spoken language wasn't good enough. So instead, my dad worked as a waiter in a restaurant, and my mom sewed clothes in a factory. And so then I was
So did
born.
my mom, by the way.
Oh, is that right? No, amazing. And my mom still sews, which is incredible. But when they, got to this country, they were in search of the American dream, if you will, and they went ahead and had a family. And so I was born here in the United States, but we were quite poor. I didn't know it at the time. It was just life
Yeah,
for me. No,
yeah,
I was poor, but we lived in a trailer park. I was on Medicaid. I remember counting out food stamps, all of that. I think what that did for me is just sort of gave me my first opportunity to understand what needed to happen to be resilient, and to be able to see how you could be successful in the face of adversity. And my parents really did model that for me and my brothers. It was really, I've kept myself really lucky have grown up that way and to have learned how to is find ways to succeed despite, not quite having as many resources as others. Over time, they actually saved up enough money and opened up a Chinese restaurant. So I actually spent most of my childhood working in a Chinese restaurant. Whenever you go to a Chinese restaurant and you see a bunch of little kids who are kids of the owners running around, that's pretty authentic.
yeah.
So, so we grew up working in a Chinese restaurant, and little did I know that working in this small business was really a prelude to operating a pediatric practice. I was learning about customer service and managing
That's right.
inventory and working on it with employees and all of that. And so many of those skills, I didn't know it at the time, but they translated into skills I used later when I eventually became a pediatrician and opened up my own. Well, I didn't open up my own practice. I became managing partner of our practice. When I was 9, I at that time didn't know I wanted to be a doctor. I had to do a project in the fourth grade as to what I wanted to
Yeah.
be when I grew up, right? And I didn't know. And I was at the school bus stop. I remember this vividly in our neighborhood. I was at the bus stop, and there was a mom of a neighbor child there. And I was talking about this project, and I didn't know what to do. And she said to me, Sandy, you should become a doctor. And I
Hmm.
looked at her and I was like, okay, that sounds great. I had not really been to the doctor. My parents, we used the health department for our vaccines, and we only went to a doctor if we were, something was falling off or bleeding, a lot. So, basically, I didn't actually know what a doctor did, but what she did, it turned out she was a nurse. She was an OR
Mm.
or an operating room nurse, and she gave me the little cap that you wear on your head, when you go into the operating room, and little booties to cover my shoes. And she gave me a tongue depressor and let me borrow her stethoscope. And I got to wear all of that to school for my project. And I just thought that was so much fun. And also when you say you want to be a doctor, you get a lot of positive reinforcement, as you can imagine. So, so of course I wanted to be a doctor, and luckily it worked out. I was good at math and science. I enjoyed I loved biology, enjoyed psychology, loved being around people, and so it did work out. And I did eventually become a pediatrician, and like I said, started learning. I like the business side of medicine, which I credit to the restaurant. Um,
Yes.
and then, over time, built the practice with some others, and we formed a large group now called Trusted Doctors, and we now have 300 pediatric clinicians in DC, Virginia, and Maryland, as you mentioned, and I'm CEO of that group. So that's been so much fun.
What an amazing just sort of story and how each of these experiences sort of compounds on one another and it helps you in different stages of your journey. Just want to make a point around sort of when you were now as the sort of immediate past president of the American Academy of Pediatrics. I guess you had served and led through a very interesting period. What were some of those significant challenges that you faced, and how did you address them?
Yeah. Well, and I'm actually past president now. My immediate year was last year, but it just time absolutely flies. It's incredible.
Yeah,
I think that what I learned a lot during that year, and it's really 3 years because you're a president elect, then a president, and then a
right.
past immediate past. And during that time, I learned a ton. I learned a lot about what I didn't know, actually. And so,
Mm,
and what was really interesting is having my eyes open to being able to travel the country and the world to visit pediatricians from all over and understanding that no matter where we are, we all care for kids.
right,
We're all trying to do the right thing. We're trying to figure out how to take care of this next population that's going to be the future for all of us. And many of us were struggling with a lot of the same issues. Mental health was an
yeah,
issue that was global. I had an opportunity to go to Japan and speak to the Japanese Pediatric Society. And when I asked them, what topic would you like me to speak on, because they were inviting me to speak, they wanted me to talk about youth mental health. Went down to South America and Central America and had opportunities to speak there. And when asking them what they wanted us to talk about, or what they wanted me to talk about, again, it was around youth mental health. And over and over and over again in all the various countries we would go to, it's the same story. And I do think that we all went through a global pandemic together. We know that was impactful for all of us. And so having our young people who were already struggling with mental health issues before
right.
the pandemic just brought that more to the forefront. So yeah, so I think I learned a lot about how similar we all are, despite being in different types of systems and in different work environments. But we're all trying to take the best care of kids, and that's
Yeah.
really our goal. Yeah.
Are all those different data points and those trends that you saw going to different countries and seeing that, to say that the common denominator being the mental health challenges amongst kiddos, is that what motivated you to sort of establish the Virginia Mental Health Access Program? And I guess what impact, since starting, what impact has it had on, you know, these kiddos in Virginia?
Yeah, yeah. Thanks for asking. I think actually we started the VMAP or the Virginia Mental Health Access Program before the pandemic. So, and I'm glad we did because during the pandemic we
Yeah,
really needed it. So, really, the premise behind VMAP was that I, as a pediatrician, over the years had been seeing more and more kids struggling with anxiety, depression, mental health
right.
conditions. But when I went through residency, I'm older, but I think even now it's getting better, but we really weren't trained adequately on how to manage mental health conditions in our primary care practices. We were taught to, identify that a child needed help, but then to refer them to a specialist, to a psychiatrist, a psychologist, a therapist. And what was happening though is that unfortunately more kids were needing services, but there weren't enough people in the workforce, the
Mm,
behavioral health workforce, to receive them. So wait times were really, really long. And so I had a young man, a 14-year-old young man who had bipolar disorder, and this was in 2017. And his child psychiatrist had retired. And so
mhm.
the family was looking for a new psychiatrist and got an appointment about 4 to 6 weeks. I'm sorry, 4 to 6 months later.
Okay.
And so they
I said
asked
four to
us,
six weeks is quick for
that would be
psychiatry.
pretty good, right? Yeah, I know. Unfortunately, it was 4 to 6 months. And so then, they asked us if we could refill his medications while they were waiting for their appointment. And we looked at the list of medications he was on, and they weren't ones that pediatricians typically prescribed. So we weren't familiar with them. We weren't familiar with the side effects and the way you dose it. And also, he was on an insurance that wouldn't allow us to refill it for him. The psychiatrist had to do it. So we
Mm,
just couldn't. I mean, we could have potentially, but it would have been outside our comfort, our
right.
zone, And so what we did instead, is we called for an appointment. So sometimes when the doctor's office calls for you, you can get an appointment sooner. So we called and called and called, and we got him an appointment 4 weeks later. And so that we thought we were good. Unfortunately, during that time, though, he ran out of his medications. And when he ran out of his medications, he had an exacerbation of his disease and he got into a fight in a parking lot near my office. And unfortunately, during that fight, he actually had a gun and he shot and he killed somebody.
Oh,
So that 14-year-old ended up in juvenile justice. The other man lost his life. And to me, that really could have been prevented. There are so
yeah.
many systems changes that had to be different, though, in order for that to be prevented.
Hmm.
And and not only that, but our other kids who were waiting 4 to 6 months for appointments were suffering in the meantime, right? And the families are suffering. Unfortunately, we knew of kids who ended up taking their lives, dying by suicide while they were waiting for their appointments. There was one children's hospital in our state who had a wait list of over 1,000 kids. And
Wow.
so the resources just weren't there, but all these families needed support. And often they were coming to the primary care clinician to say, hey, help me, I need help. And so the premise behind VMAP, and I didn't invent this type of program, they now exist in nearly every state and territory because that was something we advocated for when I was AAP president. And what this program does is it trains primary care providers to better understand how to do this work. Trains us on how
Yeah.
to manage, or screen, diagnose, manage anxiety, depression, and many other conditions. And then it provides something called a consult line. So if
Okay.
I need help, so for example, for that child, if I could have called a psychiatrist and said, I have a patient who's on these 5 different medications and I don't know what to do. Can you tell me what I need to do? What do I need to
Mm,
look out for? This is what's going on with the child. Then I could have done something potentially at that moment.
mm.
And so by having this child psychiatry consult line, within 30 minutes, any primary care provider in our state can get advice from a child psychiatrist or a therapist or a psychologist. And and that's really been amazing because what it
30
allows,
minutes.
30 minutes, yeah. So I think what happens is that now, you have a patient come into your office and there's something going on and you don't quite know what to do. You can
Hmm.
call VMAP and get advice and then help that family immediately. I mean, we're not
Yeah.
psychiatrists, so we're not meant to do this long term, unless the child has something that's not too complicated. But while they're waiting for that appointment, this is something we can be doing in the meantime to help the families immediately. And then at the same time, we also in BMAP have care navigation resources because we know families need more than just the pediatrician
That's
trying to
right.
help, right? They need the therapist, they might need support groups, they might need more resources in schools. So the care navigator portion of BMAP actually has someone who calls the family and helps them navigate our crazy behavioral health system and medical health system and really helps to reduce that complexity and help them find actual people who can help their child. And so I think that's been amazing. So this program, like I said, we have advocated with federally, and now every state and territory has some access to funding to be able to do this type of work all over the country, which has been incredible.
That's amazing. That's really, really encouraging to hear. I have many thoughts about, all right, I need to put you in touch with so and so. We'll do that offline. As you're talking about care navigation, phone line, I couldn't help but think, is there a way that technology and innovation can enhance that? And just sort of given your background, I mean, when did you get really excited about technology? Was that something that you were always excited, early on, or did it sort of escalate as you got into these roles and saw that, hey, if we want to proliferate access, it has to be in combination with sort of this human to human interaction and maybe augmented somehow by technology. What's the thinking behind that?
Yeah, I am a lifelong nerd. Yeah, so I absolutely love playing with computers. And I remember my very first, it was an Apple IIe. I may be dating myself now, but an Apple IIe computer in the 6th grade. I took a basic class in my middle school that was offered. And, that was sort of my first sort of interest in computers. And I remember getting a subscription to a PC, maybe it's PC Magazine or something like that, and they would list a page where you could type in machine code into your computer and it would spit out a video game. And so it was literally just pages of numbers, and I would just sit there as a little kid and just type these numbers in, and out would come this amazing, which is totally not amazing anymore, but a video game where you could like Pong or something, where you could bounce a
Yeah.
castle. down, but I just thought it was the coolest thing. So anyhow, early on, loved computers, have continued to do that. In my various roles, I have served as medical director of informatics for a couple of
Yeah,
different health systems, including Children's National, and I have been able to help with population health work. And have done some national work in health information exchange and national registries and the like. So it's been really fun to watch the evolution of technology. Obviously, with AI now, that's the buzzword, but certainly it's technology that is more accessible to the masses, if you will, at this point,
that's
which is
right.
really exciting. And so there is an opportunity here to think about how do we use this in a way that will be helpful for as an answer to much of the burnout issues that we have already in healthcare, but also the workforce shortage issues. So in my own practice, we use a scribe. It's been amazing. The AI scribe, the ones who use it love it. Some people aren't quite ready for it still,
Right.
but that's okay. I don't think everyone needs to use it. It's just when you do use it, though, it's pretty incredible. And there's a lot of inefficiencies in our practice background, sort of the administration portions
Hmm.
of healthcare that could benefit from AI, but with some supervision. I think we all know that AI is still learning.
That's
Um,
right.
I think I had heard someone say, today's AI is the worst AI you're ever going to use. Um, and so we know that things are going to get better and things are going to
Yeah.
continue to improve, but they'll do that because we're training and we're teaching it and we're using it in a way that's helping it to adapt to hopefully a place that's safe and good for all of us.
Is there sort of an example because you've been known for introducing some of these innovative approaches throughout your career. Is there something that you feel particularly proud of, something that you can kind of share? Say, hey, here's the use case, here's how we identified it, how did we prioritize it, and here's sort of how we intervened. Is there anything to that you might be able to sort of share?
Yeah, I think probably nothing earth-shattering that no one in the world has ever done. I do think we are my family members are also very technology oriented. So I have a younger brother, Johnny Lee, who's an incredible AI engineer. My son, oldest son, is also an AI engineer. So that's pretty fun. So you're getting a theme, I think, in my family of what Thanksgiving
You
dinner.
guys love to geek out. I
Yeah, oh
love to
yeah.
geek out too. It's great.
Yes. Our Thanksgiving dinners involve about, I think, probably 10 laptops sitting around. We have like a power strip down there, dining room table. And, it's a very funny, but we love it so much. So, anyhow, but along those lines, so thinking about, is there a way to improve the way we train people? It's a lot like VMAP, so with VMAP, where you're taking a more prevalent workforce, so in that case, primary care, and then you take a workforce where there's a shortage, like child psychiatry. And how do you take the workforce that's more prevalent and help them enough so that they can elevate what they're capable of to address, you know, at least half of the issues that patients need? And then
Mm.
that will free up those super specialists, if you will, to be able to manage the more complex issues. And so I think throughout healthcare, throughout behavioral healthcare, there are opportunities like that where AI can potentially, or augmented AI, or using smart wearable devices, all these various tech things that we have available to us today and things that are coming, where we can use that and say, okay, how can we take a more prevalent larger scale numbered workforce and elevate them. So, for example, um, I founded a foundation. It's called Trusted Care Foundation. That my goal with this foundation is to do that, is to take our college students, those who are young adults who are really excited about possibly doing something in healthcare or in behavioral health, and then using technology to train them up. How do we train them up just enough so that for example, if they want to work as like an assistant in a clinic, are they
Mhm.
able to do that? And what are the skill sets that they need? And how can we train them at a larger scale? And this is really Johnny's foundation, part of what he's doing in the foundation. But how do we use that smart technology and elevate their skill sets, be it with smart glasses, be it with remote learning, be it with all the different things that that generation is actually possibly more comfortable with, right, than
Yeah, yeah. It's
real
but then I
people.
mean they're tech
Right.
dependent, right? They grew up
Yeah,
with a
yeah,
smartphone.
absolutely, absolutely. And
Mhm.
and I think knowing that you can actually use that and have them, since they're more comfortable with it, use that technology to train them faster, in a way that they're comfortable learning. And then if you're able to do that, that doesn't require you to go in person to a classroom. It doesn't require that you have access into finances to fund, a course that's a year-long course. Or even if you're not a college student and you're older, but you just are looking for a change in your career, but
Yeah.
you have to work your jobs in order to pay your rent. How do you learn at night? How do you learn on the weekends? But not just book online learning, but where you can learn real hands-on skill sets. And so using technology to bring that into your home so that you can actually learn how to do those things in your house, at home. And then eventually you still need a person to supervise. So
Yes.
eventually, right, you end up in a place where someone is actually watching you. So if you're, for example, learning how to take a blood pressure at home, using AI and using technology and wearables and stuff, at some point you have to try it on a real person. And so
Yeah.
then, right, when you come in, you show that you can do this on a real person. But it speeds up the learning process, I feel like so I think there are opportunities like that.
That's fascinating. This type of immersive learning. Do you think there's something to be said about also the interconnectivity amongst those that are coming through the program from like a cohort perspective, sharing the learnings? Because I feel like, at least for me, just speaking of when I can teach something, I know that I've actually really grasped the concept. Do you see something similar happening there?
Yeah, absolutely. And I think it comes from I think it comes from the fact that as humans, we're relational in nature. And so in order to solidify some of your learnings, because you could watch a lot of courses online, but until you
Yeah,
actually have to do the work, right? So either teach it. We have this saying in medicine, see one, do one, teach one.
that's right.
So, you see it, then you do it, and then you have to teach it. And I agree with you. I think having, again, you still need that last step of, at least I believe, of needing to be able to apply it and show somebody else how to do it. And but again, you can still do a lot of that with technology. A lot of the simulation labs are pretty great.
Yeah.
So yeah, I'm excited. I'm excited about where technology is going to take a lot of the way we learn, and make it more accessible, so that
Yeah.
no matter where you are, you can learn.
Sandy, you have this energy as you speak and this level of enthusiasm. My sense is that this is really a calling for you amongst all the different things that you're doing, and it's quite a few things. M- I'm imagining that there is a common denominator amongst those. But even then, you mentioned in the beginning of our conversation, you have four kiddos. How do you balance all of that? Is there is there a secret sauce that maybe you know something that I don't? I certainly don't. What's your
Well,
take on that?
Well, thank you for bringing that up and asking. There's not a secret sauce. I always think it's funny when we think about balance, as if it's one or the other. If you imagine
Right.
a scale, right, you have to have more of this and less of that. And I don't know that that's true. I think that the reality, it goes in a cycle. There'll be times when you need to do more of something and less of something else, and more of something else and less of the other thing. And as long as that cycle that you're in is bringing you joy, and you're finding that what you are doing is giving you purpose, then I feel like that is really, I think that's not so much a secret sauce, but it should be foundational. We have
Yeah.
a limited time on this earth, and how do we use those minutes to achieve what we feel like we would like to achieve, in that time? if the things that you're doing are leading you to that, then it's most likely going to make you happy. At least that works for me.
That's tremendous. And as you're leading your group, you mentioned 300 plus clinicians across all different locations. So there's sort of this distributed sort of model. Not everyone is in one location. How do you impact culture? Because inevitably, each clinic has its own microculture. Have you been able to sort of develop processes to influence culture in a specific way? And what's your take on that?
Yeah, we work really hard at trying to think about ways to help people flourish at work. I heard this saying once that people talk about culture all the time, but the
Yeah.
culture that you experience at work is the culture that the person right above you is setting. So. So when you think about a whole organization, we talk about culture, but in reality, when you're at work that day, the culture that you're experiencing is what your supervisor is setting for you. And,
Mm,
and so I think understanding that that means that all the way from, the CEO can say whatever, I want, but that doesn't matter if at the end of the day, if you're working at our front desk and the front desk supervisor is creating a culture that's not healthy or happy for you. So it's really important to me that everyone in our organization has some knowledge at least know sort of some of the things that you can learn because there are specific skills you can learn to be a great leader. And every
mm,
person is a leader in their own way and
yes.
is showing somebody else what to do, right? And so if you're going to
Yeah.
be a great leader, there's some skills to learn. And that could be as simple as body language, as the way, the inflection tone of your voice. There are all sorts of skills, real hard skills to learn, meaning not difficult, but just real things that you can just do to make a change. So I think
That's
that's,
great. We had a couple of guests a long while ago, Michael and Jeff, who run a really awesome company called Urban Bound, and I love their saying. They say culture is caught, not taught.
I
It's
love that.
caught, not taught. So I have swiped and deployed that
That's
numerous
great.
times, but it just sounds as though that yes, it does start at the top, but yeah, people they catch it, they know immediately.
Yes, I
Uh,
completely agree.
So how far ahead do you look, as CEO? You're obviously visionary, but like what's realistic and what's actually what do you actually do?
Yeah, I think I always assume that the answer is yes. I will never I rarely will come up with an idea and be like, oh, I can't do that because, or that's not possible because. I think, of course, as you start to implement, you have to pivot and move with the opportunities that come before you. So when I am looking ahead, I think, I mean, in a realistic time frame, 5, 10 years, maybe, but I think what I'm actually doing is just looking around more than anything, just looking
Mm,
around me. Where's a problem that I see or that someone's brought to me? And then what's a possible solution? And then let's try
mm.
to solve it. Let's find a problem, try to solve it, take it as far as we can go with it and see what happens.
How fast do you move on it? And how do you prioritize problems? Presumably there's many problems. So I mean, is there like a little suggestion box? How do you sort of take stock of these problems, rank them, prioritize them? Is there a methodology and a process to that?
Yeah, and yes, and I think that the problems are of varying degrees, right? So they're simple problems like I
Yeah.
can't find this file. How can we create the different filing systems so that we can find things, right? So there's that level of problem solving. But I think the more where I sort of resonate and live in a little bit is more those big scale problems, like there's a mental health workforce shortage. What can we do? How do we
Mm,
help solve that problem? There's a child who's suffering. How can we solve this problem?
mm.
And so, if we are doing that, how do we prioritize? I think what I tend to do is find things, actionable things. I can't stand the meetings where we just talk about it. for a long time. I'm not that way. I think I was working with someone at a government agency, and they called it Chung time. So they named a time after me because I was like, we can do it. We can do it right now. Let's just do it right
Yeah,
now.
let's go.
Obviously, yeah. Let's just do it now. Let's see what happens. Now, of course, there's reality behind that, and people have real jobs that they need to focus on. But what's interesting is that if you identify a problem that affects a lot of people, then suddenly a lot of people want to help you and they all want to help solve the problem. And when you have a problem that a lot of people have and that a lot of people want to solve, it's incredible what you can do. That teamwork
Yeah.
is amazing, right? And so again, it's taking just identifying something that many people agree with you as an issue and pushing that forward and having them help you. Um,
Hmm. And I couldn't help but sort of read in between the lines as you're talking about sort of showcasing folks, getting them trained up, given the workforce shortages around physicians. But are you starting to see the effects of that now amongst pediatricians? And is that sort of your way of proactively going after the problem to get people sort of accustomed to here's what a pediatrician does, look how rewarding this work is? Are you sort of tugging on those alignment strings to get more students to possibly maneuver into this sort
yeah,
of space because it is fulfilling, it is gratifying.
Yeah, it's one of the most gratifying specialties, I think, and one of the most gratifying jobs. I'm completely biased, but I think that it's amazing, and it's because the work that we do as pediatricians affects the entirety of the future generation. 100% of the children are going to be our adults, right? So it's something where if we help the kids develop into healthy grown-ups, then we know our future will be secure. And so as a pediatrician, you just have this incredible opportunity to be a part of that. But yes, I think like the work with Trusted Care Foundation, the work with training the future workforce, even VMAP, helping primary care be able to do more and have the tools that they need to do the work. That's so important. I think just figuring out all the ways you can support our primary care industry, not just pediatrics, but family medicine, internal medicine too, and because they're critical to our future health, and
That's
so
right.
we need enough of them. And so if we can show young people, if we can show college students or young adults that this is an amazing career and if you're in the mood to impact change, and so many of our young people are more advocacy oriented, that if you're in the mood to find something that's super fulfilling where you can impact change, primary care and pediatrics especially is the place to be. So yeah, it's incredible.
Well, just along that thread before we wrap up, you talk about advocacy and policy and influence because there's an aspect of that you need in order to be able to sort of tackle some of these challenges. Is like what part of your career helped refine that the most? And if someone is just I'll just say they're a practitioner in a group, what how can they harness that muscle? How can they, really build up that muscle? Because it seems like that is a skill. That's not something that you just walk out of from medical school and say, "Hey, I know how to do advocacy and policy reformation, etc."
Yeah, I think what a lot of clinicians don't realize is that they're the actually incredibly they already have a lot of the tools to become an amazing advocate. When we walk into an exam room and there's a patient or a person who we need to say, gosh, if only you would quit smoking, these three things would happen and go away, or if you as a child, make sure that you are getting enough sleep at night, then what we're doing is we're advocating all day long. At every patient visit, we're actually doing a miniature version of advocacy. We're giving examples, we're providing the science, if you will, behind what's going on. We may even be telling a story about something. And so when you do advocacy, if we're thinking about it from a policy level or a public level, and certainly I have done that quite a bit, have been I'm in close proximity to Washington, D.C., where I'm
Yeah.
located. And so have, had the honor to speak before Congress, have had the honor to speak to our governor, to do all of these things. A lot of it really just has to do with teaching, because they're just people too, and they cannot
Right.
possibly know all the things. And so, as much as you're able to, in a nonpartisan way, really just think about the humans, how do we help
Yeah.
people? Help each other. And these are the things that could be helpful. These are the things that might be hurtful. And let me just show you what those things are. And let me tell you a little bit about a patient I saw who, if this policy goes away, they're not going to be able to come see me anymore, and this child's not going to be able to get health care. And we know, and here are the things that could happen in that case. And I think understanding that as a clinician, you're already an amazing advocate. It does require a little bit more, but it can be as little as sending an email to your legislator if it's a
That's
legislative
right.
issue, or to an insurance company, right? If it's a payer issue, or to your local whatever, whatever the issue is. There was a pediatrician who was an amazing advocate about nutrition, and she worked with her local restaurants, in her local
Mm.
community, and to teach the community about what was healthy eating and what wasn't. And so I think that's really, you can be an advocate in so many ways. It doesn't have to just be in the sort of political framework, although that's absolutely needed too. So yes.
Well, I appreciate you framing that because now someone can potentially feel empowered. And this has been amazing. Before we wrap up, I'm just curious, is there anything else that you want to share, with our audience, with our community, maybe about upcoming projects or just sort of a key message that you want to leave with us in terms of what we can take action on?
Yeah, I think that one of the main messages is that as each of us thinks about how we got to where we are, often you can think back to someone who influenced you, who got you to where you are, and just realize that today you are now that person for someone else. And so, as an individual, we can each affect change. And if we can each reach out to someone else, a young person perhaps, a college student, someone, again, Trusted Care Foundation is really centered around that. How can we teach them how to be leaders, our future advocates, our future clinicians, all of
Yeah,
those things, I think, but in really remembering also the importance of taking care of kids. I think that's our future always. And so whatever you can do to help a child to be healthier, that would be incredible.
that's amazing. Dr. Chung, I have to say, I've worked alongside and connected with a number of different pediatric clinicians, and I think the ones that stand out the most to me were the best connectors and the best communicators because they're not only just talking with the kiddo, they're communicating with the parents and have this ability to sort of disarm and put people at ease. And I just have to say that I felt that today, even though we're separated through a screen, I felt that like in spades. You have that in spades. It's probably one of your superpowers. So thank you for coming on and even just sort of sharing um, many, many golden nuggets. There's been a lot that you've shared. So for those that have tuned in, if you happen to find this conversation particularly enlightening, helpful, would you mind sharing it? Would you mind commenting on what stood out, what you're going to do, what you're going to take action on? Because as a community of innovators, it is about taking action. It's not just about talking, thinking, and meeting. It's about doing. And you have Dr. Chung, a bias towards taking action, and I love that. So you're obviously always welcome to come back onto the show, share new things that you're working on. So thank you again, and I'm looking forward to future conversations with you.
Well, thank you so much for having me. Appreciate it so much.